Hi, today we're going to talk about the endocrine system and the endocrine glands. Now, why is it important to talk about the endocrine system? It's because of the fact that the endocrine system is an important component of the human body or structure of the human body that controls our body in many ways. Endocrine is different from exocrine glands because exocrine glands have ducts, like for example your sweat gland. Skin surface is a duct. The gland, like the sweat gland, contains sweat. If you perspire, the sweat passes through the duct, comes out in the skin pore. Now, endocrine glands, such as found in the body, are glands that do not contain ducts and therefore will allow hormones which are produced by the endocrine glands to be released directly into the blood circulation to be able to bring and reach its target organs. So there's a big difference between endocrine glands and exocrine glands. So let's try to mention some of these endocrine glands that are found in the body. Okay? First, in our brain, our brain, as you can see, our brain is very important. There are two important glands there. Actually, there are three. Okay? In the brain, you have the hypothalamus. Now, why is the hypothalamus important? The hypothalamus is important because it is the master of the master gland, which happens to be the pituitary gland. Used to be the master, but now it's actually controlled by the hypothalamus. The hypothalamus, therefore, is able to control the pituitary gland through releasing hormones and inhibiting hormones. The hypothalamus by itself is important because it produces two hormones, the antidiuretic hormone and oxytocin. These two hormones are produced by the hypothalamus and are brought to the posterior lobe of the pituitary gland, which will now store these two hormones. Okay? Now, what does the antidiuretic hormone do? Well, it's very important because in the event that you become dehydrated, for example, when you have diarrhea and you lose a lot of water in your stomach, the antidiuretic hormone will be released from the posterior lobe to make it go to the target organ, which is the kidney, and the kidney in turn will what? Conserve and retain the water to be able to hopefully maintain your fluid balance. But although we know for a fact it's not enough, that's the reason why in diarrhea we give fluid replacement in the form of IV fluids or oral fluid replacement. At the same time, another hormone is oxytocin, which is released by the posterior lobe but produced by the hypothalamus in the event that a woman goes into what? Labor. Okay? So these particular hormones from the posterior lobe of the pituitary gland, by the way, the posterior lobe of the pituitary gland is also known as the neurohypophysis. The posterior lobe releases oxytocin in the blood circulation, reaches the myometrium of the uterine wall, myo means muscle, making the myometrial muscles contract. Once these muscles contract, then it will be able to be responsible for expelling the baby from the uterine cavity. This oxytocin is also important because not only for uterine contraction during labor, but at the same time responsible for the release of the milk when the baby begins to suck the nipple of the mother. Okay? So this particular hormone called oxytocin is important for milk injection. Okay? So two hormones for the posterior lobe coming from the hypothalamus. These are ADH or antidiuretic hormone and the oxytocin. On the other hand, the anterior lobe of the pituitary gland, also found inside the brain, is important because it's also known as the adenohypophysis. Many hormones are found there. One is growth hormone, responsible for our growth. Do you know that growth hormones are released more if you sleep at night and you have enough sleep? That's why if you have kids and children and you want them to be hopefully taller, you would encourage them to sleep because growth hormones are known to be released more during sleep. So growth hormones reach a target organ such as what? The muscles and the bones to make you become taller and bigger. Now there are other hormones such as the thyroid stimulating hormone, which comes from the anterior lobe of the pituitary gland and of course into the thyroid gland here, which makes the thyroid gland secrete its own hormones, the T3, T4, and calcitonin. Other hormones such as ACTH, which means adrenocorticotrophic hormone, is responsible for stimulating the adrenal cortex of the adrenal gland, which is found here. right above the kidney. We're going to talk about that later on. Adrenal gland is also known as suprarenal gland. Other hormones would be the luteinizing hormone in the anterior pituitary gland, which is important for triggering ovulation, which is basically the release of the egg by the mother 14 days, or the woman 14 days after the first day of menstrual flow. So luteinizing hormone, keyword, ovulation. Okay. Now we also have the follicle stimulating hormone, which is important for stimulating the ovarian follicles in the ovaries, and the interstitial cell stimulating hormone stimulating the interstitial cells in the testes. These are all coming from the anterior lobe of the pituitary gland. Another hormone from the anterior lobe is your prolactin. And what does this hormone do? For milk production. Okay? Oxytocin for milk ejection when the baby sucks the nipple of your mother. At the same time, your prolactin, on the other hand, is for milk production. Okay, prolactin. Now, from there, we have talked about the hypothalamus, we talked about the pituitary gland. Let's now move on to the pineal gland. The pineal gland is another gland in the brain responsible for the secretion of what we call the melatonin. Now, why is melatonin important? It is important for the fact that it is important for regulating your waking and sleeping patterns, or circadian rhythm. So remember, every time you think of melatonin, you think of waking, sleeping patterns, you think of the circadian rhythm. Now from the brain we move down to the neck. In the neck you have this big gland which is right below the thyroid cartilage of the Adam's apple. It has two lobes, right and left, joined by the isthmus, and apparently these thyroid glands secretes three hormones. T1, which is triiodothyronine, triiodothyronine, and T4, which is thyroxine. These two hormones are important for cellular metabolism, which is defined as the sum of all the chemical reaction that takes place within the cell. So these hormones therefore affects every single cell in your body, including the brain cells, the bone cells, muscle cells, all the cells of the body. A child or a person that does not have enough T3 or T4 hormone, thyroid hormones, can that affect their brain cells? Yes, it will. So there is a condition called cretinism, cretinism, whereby a child without enough thyroid hormones or hypothyroidism may end up developing mental retardation. The good news is that we can do hormone replacement at a young age. Another thing of the effect would be on the bones. So these children, when you are a cretin, not only are you mentally retarded, but at the same time, it will affect your growth. The growth will be stunted. They end up with dwarfism. Again, hopefully the hormone replacement will make them attain their normal height. Now, can this also affect adults? Yes, it's called mixed edema. If you have hypothyroidism in adults, it's called mixed edema. A lot of these individuals are forgetful. Okay? And they have slow metabolism, they have a tendency to gain weight. At the same time, the heart rate is low and they have cold intolerance. So that's why we often provide them with a blanket. Now, what about your other hormones here? The calcitonin is coming from the thyroid gland. And why is that important? Because it is the hormone that will lower the blood calcium levels, allowing the calcium in the blood to go to deposit in the bone, making the bone become stronger. There's a reason why calcitonin can actually be given to patients with osteoporosis. I remember a fact that we actually prescribed this medication in the form of a nasal spray to strengthen the bones of those patients with osteoporosis. Now, the other gland is called the parathyroid gland, which is found behind the thyroid gland, which is essentially has hormones called the parathyroid hormone. And what does this hormone do? It's the opposite of the calcitonin. And what does it do? It increases the blood calcium by allowing the calcium in the bone to go where? Into the blood. Okay, that's the opposite of your calcitonin. Now, let's move on now. In the thymus gland. The thymus gland is not shown here, but essentially it's in the mediastinum, with the space between the lung, right in front of the heart. Now, the thymus gland secretes thymosin, Thymosin, and what does this hormone do? Essentially, it allows the T lymphocytes, or the T, as in letter T, cell to mature within the thymus gland. If you recall, the T lymphocyte is a white blood cell produced by the red bone marrow, but it has to mature and be prepared to fight the enemy, in quotation mark, by developing immunocompetence in the thymus gland. Unfortunately, the thymus gland becomes smaller as we get older. In a child, it's big. Upon reaching puberty, it starts to decrease in size or develop atrophy. And as we get older, therefore, it becomes so small that this could be one reason why as we get older, we now become more prone to infection because of the decrease in size of your thymus gland. Now, as we go down, let's talk about the adrenal gland, or the adrenal gland, which essentially is also known as suprarenal gland, which is found above the kidneys. Now, the adrenal gland has two components, adrenal medulla and the adrenal cortex. The adrenal medulla secretes your adrenaline or epinephrine and noradrenaline or norepinephrine, which are neurotransmitters that are part of your sympathetic nervous system. What do? Increase the heart rate, and what else? Bronchodilate, essentially part of the sympathetic nervous system. As we know, sympathetic nervous system is for survival, the fight and flight response. Your pupils dilate, the air is open through bronchodilation, increase the heart rate, which is essential in survival. Okay? Now, what about the adrenal cortex? Essentially, there are two hormones. One is called the glucocorticoid, which is essentially your cortisol. These are glucocorticosteroids derived from fat or cholesterol. The cortisol will increase your blood glucose. That's why it's called glucocorticoid, especially during a flight or fright response, where you need more sugar to survive. The second one is called the mineralocorticoid, which is your aldosterone. It has a lot of functions. Number one, sodium and water retention. Wherever sodium goes, water will follow. So it makes you retain water and sodium. But at the same time, this same hormone will allow potassium excretion by the kidney, which happens to be its target organ. Okay, so that is the function of aldosterone. Now, what about the hormone produced by the pancreas? The pancreas, as we know, is an important gland. It's unique because it's both exocrine because of the pancreatic ducts and the pancreatic enzymes released into the small intestine, particularly duodenum. But at the same time, the pancreas is also an endocrine gland because of the islets of Langerhans. The alpha cell secretes glucagon, which essentially increases your blood glucose level, but your beta cells of the islets of Langerhans of the pancreas secretes your insulin. Okay? So, what does insulin do? It lowers the blood glucose levels. Let me illustrate it here. If you know and remember, every time you eat, the food we eat, esophagus, stomach, small intestine, the food we eat, the glucose goes into the wall, which contains muscles and contains blood vessels, and the glucose goes into the blood. Our blood glucose level therefore goes up. So if this were a cell, this is your blood vessel. What does the blood vessel contain? Obviously it contains blood. The glucose after a meal goes into the blood. This is the glucose here, G for glucose. There is hyperglycemia, or the glucose level goes up. What does the beta cells of the pancreas do? It secretes I into the blood in response to the elevated blood glucose levels. Now what does I do? What does I mean? It's like a what? A key. Like this. It opens the door. Remember, you need a key to open the door. So the I goes to the door of the cell, which is the receptor, and this key, which is insulin, opens the door, and once the door is open, who will go inside the cell? Glucose. Glucose goes inside, and the cell is happy because it now has a source of energy. So, without the insulin, what happens? If there is no key, if I throw this key away, if there is no more key, will I be able to open the door of the cell? No, I cannot. And will glucose be able to enter the cell? No, it cannot. And therefore, glucose remains in the blood. That's why you have hyperglycemia. Hyper means high, glucose, emia means blood. And this, of course, is the condition called what? Diabetes mellitus. Okay? So therefore, in diabetes mellitus, the problem is the lack of what? Insulin. Therefore, what do we tell the nurses? As a medical doctor, I tell my nurses to inject the patient with insulin because they lack the hormone called insulin. Okay, we're going to talk about this in the next few videos. We just suffice to say that the pancreas is such a very important organ. Now, what about the other organs in the pelvic area? Well, you have your ovaries and your testes. The testes secretes the hormone called testosterone, which is the male androgenic hormone, for the secondary male characteristics such as what? Change of the voice, axillary hair, pubic hair, increase in muscle size. On the other hand, the ovary secretes what? Estrogen. Again, in women, it's the one responsible for the secondary sexual characteristics such as what? Again, axillary hair, the development of pubic hair, at the same time, the excess fat deposits on certain areas of the female body. On the other hand, the progesterone is the hormone that is responsible for the maintenance of pregnancy. So bear in mind, for pregnancy to be maintained, it is important that we have enough progesterone, because it is the one that will make the wall of the endometrium thick prior to the implantation of the fertilized egg, in the event that the egg was fertilized by the sperm. So you need a fertilized egg to be able to implant on the wall that is thickened by the progesterone. Increase thickened wall, at the same time more blood vessels found within that wall to be able to provide the needs of the developing embryo in that particular situation. Okay? So those are some of the important hormones by the endocrine gland, and in the next video we're going to talk about some of the disease conditions that are seen in these endocrine disorders. Have a good day. Thank you.